All right. Thank you for having me today. I'd like to thank the entire John Snow Labs team and Dr. Talby for allowing me the opportunity to speak again at this wonderful annual event. In 2023, at this event, my VA team introduced autonomously orchestrated multi-agent solution, which we think might have been one of the first in the world to be at least discreetly worked on. Today, we call that agentic AI. And I would bet that 18 months ago, many of you hadn't even heard of this agentic AI term. After retiring from the VA, I co founded a company called Lunar Analytics. The focus at Lunar Analytics is to harness all of our clinical and technical expertise with our agentic AI experience to inject transparency and efficiency into healthcare. We believe that if we apply these new technologies across the healthcare system, we'll deliver a paradigm shift that can cause the necessary disruption we need to really help save this industry that is really in peril. For today, what we're going to do is we want to talk through and talk to you about one of the steps in the direction that we're taking, which is using agentic AI to drive pharmacy benefits to generate value and improved outcomes in this presentation, generating value and improved outcomes in pharmacy benefits management with agentic AI. So we know that healthcare crisis in the US is always in the news. We spend more waste, more and have worse outcomes every day. The complexity, the bureaucracy, and the systemic inefficiencies of our system mean that about 25% of our $5 trillion in spending is wasted. But the adversarial, siloed, and short-term emphasis of our healthcare system is also to blame. Today, we'll discuss how to reduce wasted dollars, improve health worker morale, elevate client member satisfaction, and enhance pharmacy benefits administration. Some recent estimates indicate that there's now over $1 trillion wasted annually in the US healthcare system. The waste in current workflows and processes account for as much as 30% of the total spending. Can you imagine that? 30% of what we spend might actually be able to be recaptured if we can really improve the workflows that we have. There's a lot of different types of problems that lead to the inability of our healthcare system to consistently deliver outcomes, prevent fraud, abuse, and eliminate resources and excess dollars spent on overly complicated tasks and workflows. Some of these more common problems that help to provide waste in the system are a failure of care delivery, failure of care coordinations we'll see a lot of times. We'll see a lot of overtreatment and maybe provisioning of low value care, as well as like pricing failures and administrative complexity. I'm sure you've seen a lot of these different examples of waste. And as you can see on this slide, we know that in one particular aspect, especially in the prescription drug market and insurance market, is the amount of time and money that we spend on prior authorizations. The prescription drug and medication supply chain industry is riddled with manual processes, overburdening regulations, profit-centric business models, disjointed knowledge, and all while we need to make these highly specialized medical decisions. To control spending, one methodology that was implemented in the 1980s was the concept of drug formulary. The drug formulary is a list of prescriptions or products that a payer has defined as safe and effective and covered under their standard plan and respective copay tiers. Generally speaking, a lot of these decisions historically have been made more on cost and price. Now, we also know there's a lot of medications that are on the formulary. Obtaining those medications require the payer to approve payment for those medications or to pay for the medication out of their own pocket. Sadly, patients statistically only stay with each payer for maybe 3 or 4 years on average. What this does is it decreases the return on investment that's captured by the payers on these high-cost medications. Because those high-cost medications generally only generate value many years in the future after preventing a significant amount of mortality or with a patient and reducing hospitalizations and et cetera. They're not seen immediately. So this is a system that de-incentivizes outcomes and minimizes and changes the value-based formulas that are used. This can lead to distrust, some complex ethical decisions that are being made, as well as a lot of bureaucracy. All this has led to an explosion in the implementation of increasingly complex non-formulary medication prior approval systems that intentionally or not dissuade providers and patients from always receiving the therapy that's preferred by them. The knowledge and technology needed to execute safe and effective prescription prior authorization has made it impossible to effectively automate the entire process. And currently, pharmacy benefits organizations are charging $35 to $35 to $75 for each prior approval or prior authorization. If an appeal is made, it may be hundreds of dollars. As a result, providers average about 40 or more prescriptions per week that require prior authorization. This puts a tremendous burden on the providers, the nurses, and the clinic staff. As you can see here on the left, it's the number of hours per week that are estimated to be spent by each of the staff. The smaller the clinic, the more that falls on the provider. So you can see that while maybe a provider in the study and the system that was studied here only spent 4 hours, you can imagine that if it's a smaller clinic or a private practice doctor or even a doctor in an organization where they don't have a lot of secondary staff, that could be 10, 20, 13 hours. Some cases show 13 hours physicians spend a week on them. It's incredibly burdensome and helps greatly creates workflow disruptions as well as a lot of burnout within the physicians. This frustration and confusion that's created with patients is also estimated to cause a 20% rate of patients not filling the first time fill. This can't all be attributed to prior auth, but the dysfunction in our existing formulary management system certainly contributes to it. So we know that billions of dollars have been spent over the last few decades on software, algorithms, clearinghouses, electronic health record packages to help remedy these problems. Unfortunately, healthcare has a lot of fringe cases. These fringe cases are what we call problems that live in technical gray areas that really exist between defined standard practices and the nuances that are required in treating individuals and supporting healthcare sites that are highly variable and require a lot of different resource technology. So you can imagine it's very different trying to execute a new technology in a small rural 25-bed hospital than it is at a large academic institution. Therefore, a lot of different practices have to be accounted for, and historically, the use of natural language processing and rule-based solutions have struggled to reliably perform in these areas. The reliance on point solutions, robotic process automation, plugins to existing solutions, and outsourced staffing has led to outdated prior authorization workflows that are heavily human dependent, broken or rigid supply chain management systems, rule-based exchanges and event pipelines that lead to misrouted claims. We'll see manual formulary management processes that are still used because there's just a lack of data standardization. And a lot of the knowledge that's needed for review is stored in blobs of data like progress notes or PDF files or other. We also still have a holistic integration problem. And it's been very difficult to have the capabilities across all systems to be able to really have a universal multi-solution integration to aggregate data in a meaningful way to help make some of these more difficult decisions. So, why did we believe that we could develop solutions that could succeed in fixing some of these really hard problems? The confidence really stemmed from our experience. Our teams work independently and together have solved many of healthcare's very complex problems. Each of our members has worn a lot of different hats in our careers. We have experience in all aspects of clinical, operational, executive, and informatics pharmacy practices, as well as staff with legal, finance, startup industry, a lot of like full stack engineering technical experience, architecture. And like I mentioned, many of our team members have actually been working on multi agent workflows since early 2023 now. I still remember the day AutoGen came out and we were like, hey, that's what we're doing. And so it's a really exciting to be able to put some of these in practice. So first, it was pretty easy for our team to identify that past technology lacks the capability to reason and to think and to research all the complex knowledge that's necessary to reliably deliver trusted and effective outputs. It quickly became clear to us that our overlapping subject matter expertise, along with our experience with hyperscaled enterprise data solutions in like the Department of Veteran Affairs and other very large tech firms and organizations, really gave us the necessary experience to apply agentic AI and to enable us to really develop disruptive technologies that can make a real difference. So what we decided was, as we focus on supply chain management as a whole, there are two primary areas that really had an opportunity to see a great advantageous improvement with the use of agentic AI. One of them was the ability to optimize reimbursements through copay cards and through formulary optimizations. And the other we're going to talk about today was really this concept of the prior authorization that we mentioned. Now, prior authorization is complicated from the standpoint that it has a lot of different chefs in the kitchen, I guess you might say. Those chefs have a lot of different roles and they have a lot of different priorities. And it makes it very complicated whenever you have competing priorities within a single workflow. One of the things that we felt was very important that we could do was to help bring some honest brokering by the use of agentic technology, using standardized knowledge bases as well as expandable and shared memory and training models. We're able to replicate a 1 million-person workforce that stays within very strongly governed standards, can be trustworthy and can be monitored and can be very effective at helping to mitigate some of the issues in this process. So as you notice, the medication administration process is broken down into kind of 5 different core functions that exist in it, 4 different domains. You have a physician prescribes the medication. That medication is sent either by electronic medical record message. An EDI message is one of the opportunities that exists there, along with FHIR and other. Typically, you'll see a NCPDP message that's sent from the health record over to a clearinghouse, then to a pharmacy, and then routed back to a pharmacy benefits management company and so forth. You can also actually have a prescription brought into a pharmacy and initiate from the pharmacy. But at that point, there's a decision that's made that a medication is not formulary, needs to be prior authorized. And the physician is notified of that along with the pharmacy, and a relatively complex process initiates of information needing to be collected and sent by the provider back into the insurance company, reviewing that information, determining if it's approved or denied. If it's denied, then the patient is informed that patient is denied, and the provider must then determine whether or not they want to appeal that decision, which then leads into another tier category of cost, which in some cases is up to hundreds of dollars actually to have that reviewed. But the provider can then appeal it, and if they appeal it, then it can be reconsidered. If it's approved, it's sent back to the pharmacy to fill, the patient receives it. If it's not approved, then either a different medication must be selected, treatment is just foregone. Maybe sometimes the patients give up on it, or in some cases, they'll attempt to do another appeal to try to make that happen. So when we looked at this, we really had to decide why and how is Agentic AI going to help us solve the solution. And as we wanted to step through each part of that, it really began to showcase to us that it was definitely the direction to go, and that our experience is showing us that a lot of multi-agent capabilities really tune themselves into allowing us to have some great benefit in helping to really disrupt the system. I think you'll notice that we kind of looked at three main areas. I think the one thing you'll notice that's required with a prior authorization is really a lot of good orchestration. That's really our sweet spot. That's really where we started a couple years ago, and why we chose to go with multi-agents a few years ago was as we were working through dealing with cleansing and extracting and building and formulating new data extractions along with complex clinical risk scores, et cetera. We really knew that the capability of an agentic AI model to kind of orchestrate processes through that allowed us to minimize hallucinations and to really help improve the output we were getting. It also enabled us to increase and introduce a lot of different governance points within a workflow to make sure that we're keeping things in check. And I think you'll even start to see more and more purposefully inserted adversarial workflows as well too, for agents. We're seeing a lot of kind of cool things happening with that. We also know that the really cool thing about our agents is they're really good at interacting in real time, right? The speed at which we're able to process knowledge through our agents is pretty incredible. And its ability for us to have multiple agents working together on one knowledge base at one time really helps to parallelize a lot of activities that we're able to do. So I think that it's really important to kind of really understand that we can increase the integration in real time with not only payers, pharmacies, but also all the knowledge that's needed for manufacturers as well. And then, as I said, like with our experience, the way in which we build all of our products in an agnostic open source methodology, it allows us to be hyperscale very quickly and very effectively. So we can do billions and billions of transactions in a short amount of time. So what I want to show you real quick, this is just a quick little flash. I can't show much, but this is to show you that it does exist. We have a prior authorization screenshot here. The screenshot allows you to kind of see that it informs the provider of certain information, and then that provider is able to take different actions to help facilitate the movement of it. So as we went through and we finished the first version of our models and of our workflow, we realized that in order to truly be a company that really genuinely practices what it preaches, we probably needed to look into kind of third-party methodologies of helping to validate, govern, and improve all of our tools that we leverage. And of course, with some experience I've had in the past with Johnstone Labs, they popped right to mind. We were very excited to have an opportunity to reach out to them. And at that time, we realized that their advancement was in parallel to ours. And they had done a lot of really great work, not only with enhancing their natural language processing methodologies with large language models, but also had really focused and had begun to really invest in governance and trustworthy AI stewardship, including a relationship and development of Pacific AI, which we're excited to also begin to work with and help establish some really strong governance patterns around all of our frameworks. In addition to the security, why is it a good partnership? One is there's a lot of different data sources that we have to ingest. They may be HL7, they could be FHIR, they could be multimodal, it could be PDF files. We even have images that come across. We've got blobs of data, all of this data. And we have simultaneously been working together when I was at the VA and then continued now on continuing to enhance the kind of accuracy, particularly in the precision and the recall gains that we've been able to be seeing over the last few years, and able to really help ensure that we have a strongly reliable and transparent extraction process. We also know that a lot of their LLM capabilities focus on some agent orchestration as well that helps us break down really large blobs of data into different clinical queries and helps us to expedite, optimize a lot of the decision and reasoning functions that occur within our systems. As there have always been a world leader in healthcare NLP processing. I think one thing that we're very excited about with the partnership is our ability to continue to enhance security and safety by utilizing some of their de-identification and obfuscation methodologies, as well as their really optimized capabilities of tokenizing a lot of unstructured clinical data. And then finally, one of the final things that we both jointly were working on, and I will say honestly, it was unknowns to me until we connected again, was on this kind of concept of unified patient journey intelligence. And it's really being able to create a multimodal ingestion capability of medical data into unified, so-called like unified knowledge bases that can be leveraged not only by the patient, but also by other entities to help improve that journey. So I think as we come to a conclusion, I know we weren't able to necessarily throw up a lot of cool technical schematics, and we weren't able to really give a strong demo on our tooling and capabilities. But I do think that I hope you've gotten the concept of being able to take an incredibly complex, difficult workflow, ensuring you have the right subject matter expertise involved to help come up with very creative solutions. And that by building out this agentic AI, we can actually see them working in the very complex healthcare world. Definitely want you to take away that really the reason we're in this is to create honest brokers. We partner with Cure Patient, who does the same for medical claims, and Lunar Analytics, our company, is very dedicated to that transparent, honest brokering of healthcare throughout the whole system, and to begin to eliminate bias and conflict, kind of prioritization conflicts between different people's motivations. The other thing you can tell that we were able to do, and I hope came across, is we're able to really bring things to scale. We've got the core infrastructure built and ready to go for healthcare exchanging, for a lot of other additional tools in addition to just this. What can you do? You're all patients, you're all stakeholders, every one of us. Help get the word out, help understand that there are ways to safely implement agentic AI and different methodologies to help improve the satisfaction with payer systems, help improve your experiences. Let's help keep providers happy, right? We don't need them to be too busy, and try to keep their job satisfaction up so we can keep them around. They're important. They're very important aspects of our lives. And I think that for far too long, the burden has continued to pile on them. Speak with your healthcare leaders if you have connections with decision makers in your self-paid insurance business, say your self-paid insurers, or if you work in the payer industry, or you work in large healthcare systems or small healthcare systems, if the decision makers, have them reach out to us. We're here to help fix the system, not just sell our product, which is always beneficial, but certainly if we have opportunities to speak with C-suites or with other true decision makers, we like to share what we know. And finally, let's send that message to stop losing millions, and let's demand transparency from healthcare. AI can do it. Like AI in itself doesn't require a lack of transparency. In fact, especially utilizing agentic AI capabilities, we can begin to expose transparency that we even weren't able to before. We can't show what your doctor's thinking, but we can definitely be able to utilize logs communication across multiple agents to determine how decisions were come to. Please reach out. Our contact information is below here. And I hope that we might have an opportunity to speak with some of you or your decision makers in the near future. Thank you very much.